they were curing a lot of mice when the boys were little. So I went to conferences and I saw mouse models that were living longer. Just heard at a conference this week that it's a really great time to be a sick mouse because we can cure them all. But there weren't any clinical trials in boys. Then we had a couple of clinical trials in boys that failed miserably. I took a few years off from conferences because my boys were getting older. And then I heard about this type of medication. It was no longer a medication. It was an RNA altering therapy. And there were 2 drug companies that were going to be working on it. And it was called exon skipping. And I actually met the man who invented exon skipping in Perth, Australia, Dr. Steve Wilton. I met him at a conference at a bar. And he took this cocktail napkin and he was showing me what exon skipping was. And I said, well, my boys are missing exon 52. And he says, I have great news. The first one I've developed is to skip exon 51, and that will bridge the gap. And so this drug is going to be available soon for clinical trials. And the boys were 6 and 9. And I was like, oh my God, seriously? And he said, you've got to go to London because both these companies are going to be presenting at a conference in London. You've got to go find out your boys are, your oldest boy is coming to the end of his walking days. They're not going to let kids in that aren't walking. You got to get there. And so I had never really flown very far, but I got on a plane and went to London with my mother and met with both the companies. And I said, who's going to be first? Because I want my kids in the study. They argued about who was going to be first, but it turned out that there was a 3-year delay. And so neither one of them was first. Everything just slowed down to a snail's pace. There were some patent wars. There were just a lot of details that don't matter. But basically, we went home with a lot of hope, and then we sat and we waited. And Austin stopped walking. And so I got really kind of annoyed and jaded. And, I stopped going to conferences. I stopped talking to other parents. And then Austin's doctor contacted me and said, actually, one of these companies is doing a safety study and they're only accepting non-ambulatory patients. And I have to say, in hindsight, that should have been a red flag to me, that they were doing a safety study in only non-ambulatory patients. This is not the drug they're currently on. But I was desperate for anything. And so I was very pregnant with my daughter and we flew to Columbus, Ohio, and we stayed for 3 weeks to be part of the safety study where he received injections in the stomach to see if the drug was safe. He received placebo, I now know. And we signed paperwork that said that if the drug was safe, that he would then be allowed in the study, and the company never honored that. He was never allowed in the study. So we went home. It was a horrible trial experience, and I've learned to read consents a lot more carefully about extensions and whether or not your child's going to be able to continue receiving the trial medication, and what happens if he is on placebo, will he roll over to drug, and all of those things I had no idea. I was just so excited to be invited to a study.